Hello, everyone. My name's Chad Erickson, and I'm the Vice President of Strategy at Advice Media. And it is my pleasure to welcome everyone to our webinar today. We have an all-star crew here with us today to really help you during this, what we're going to call our COVID comeback, and to be able to help you understand how to work through your patient backlog, how you can accelerate your revenue, how you can really maximize your efforts now and as you start to reopen. You know, it's kind of an interesting time when you think about where we're at. We're looking at the fact that there have not been any cataract procedures performed over the last 6 to 8 weeks. That's huge. When you think about that and the fact that many practices have had to furlough members of their staff, there's still some financial uncertainty. You know, you're talking about really a reduction of volume of patients that's 10 to 15%. Let that sink in. When you're losing your annual patient volume of close to 15%, that's a massive impact on your revenue. Now, I don't want to be negative today, right? That's not what this is about. This is about how we create a very, very positive structure that's going to help you. But we need to be intellectually honest. We need to understand the reality of where we are today. And the good news is, on top of everything else you're going to learn today, is that we are seeing some changes happen amongst many of the states. Now, there are still some hot spots throughout the country, and we understand that. Our hearts go out to the frontline workers that are there, where our hearts go out to those individuals and families that are going through that. We understand. In Utah, we're not in that same ballpark, and I know in some of the other areas where our team today is where they reside, they're seeing some changes as well. We're slowly getting back. Our governor announced that beginning on May 1st, we are going to be open. Now, there will be some restrictions to how that works. There's going to be some differences. Even at our own office, we're going to be taking the temperature of every employee as they come in. We're going to have blue and green days and alternating the way that we see or that our employees come into the office. So anyway, it's a balancing act. And within your own practices, there has to be a change. You've got to do some things that are going to help your patients who are a little bit nervous. You set up some things that are going to help them. My daughter, for example, went in first day that the optometrist was open up again yesterday, and she's a graduating senior. She's trying to get a prescription right before she goes to college here in a couple of months. And coming in, it was immediately, you went to the bathroom, washed your hands, here's the sanitizer, here's a mask. And all of these things, you know, took place, and you need to think about patient safety and how you're going to address that. They're a little bit scared, but the reality is they still want to improve their vision. And luckily, you know, ophthalmology is an amazing market where through the great entrepreneurial spirit, through having a right plan in place, you can accomplish much. And the team that we have here today truly is an all-star team. So let me introduce each person here briefly, though they can also talk a little about their own background and tell you a little bit about our format for today. So first of all, excuse me, we are, this was initiated by Diane Weiner from Sergio Rhythm. Diane and I have known each other and had a relationship for probably the last couple of years. We have the site selector videos, and those videos are on the Sergio Rhythm platform that really helps educate patients early and often and what they go through. And so she's been the mastermind behind this, and she's a co-founder at Sergio Rhythm. So really appreciate her on that.
Thank you.
Jane Schumann is also one of our guests today. We couldn't get her video to work, but Jane's here. You're going to hear from her in just a minute. And she is the principal and founder at iTex, which is a nationally recognized workflow consultant. Many of you have probably heard her speak at a lot of conferences over the years. We also have Jonna Mullaney, she's the regional vice president for ESP management. Also has been at Katz and Eye Group, a large eye group, and so understands how to manage this within many, many practices. And then we also with us have Crystal Mamasor, who is the clinic operations manager at the Cleveland Eye Clinic, who's actually a client of Advice Media. We've never met before, Crystal, but it's it's such a large group I would anticipate that we have. But it's wonderful to have you here. It's one of the most prestigious and recognized eye clinics in the US. And so thank you to all of you for being here. Our first presenter today is going to be Jane Schuman. And Jane, you're going to talk about kind of our new norms. So I'm going to mute myself, turn it over to you, and then make sure that I think everyone can see my screen. Can everybody see my screen okay with the presentation? Crystal, Jana, give me a thumbs up if you can see the presentation. Okay, we'll make sure that we're good. Okay. All right, Jane, thank you.
Will you be turning the slides?
I'm going to turn the slides, so you let me know. Yep.
Got it. Hi, everybody. Thank you so much for giving some of your valuable time to learning about what we're calling the new normal. It is certainly a phrase that we are getting quite accustomed to, and unfortunately, we are going to have to adapt really quickly to it. As Chad mentioned, you don't see me live, and I am going to have to ask Chad to forward each slide accordingly. Chad? Okay, thank you. So the first thing we're going to look at, this is really all about planning ahead. From other webinars and other print media, you have been learning about all the resources that you have been recommended by the Academy and other organizations. These include reducing your patients per doctor, per hour, extending your scheduling hours to evenings and weekends, and how you're going to stagger your staff to schedule your clinic accordingly. So I'm really not going to spend any time discussing that with you, but what patients are going to be called back first? Again, we're moving from the emergent and urgent cases, and I would recommend that the next ones you bring in are those with chronic eye conditions who were due during the period that you were closed, such as the glaucoma, the glaucoma suspects, anyone who needed a follow-up for a corneal ulcer or an abrasion, as well as your dry AMD patients to make sure that they are still stable. But what about the surgical patients? As Chad mentioned, you have not had surgery for weeks, but many of your patients were already primed to have it. If they've gone over the 90-day requirement for a dilated eye exam, you do have to bring them back, probably for a quick dilation and refraction to make sure that they are still medically necessary and perhaps their vision is worse. And what about their H&P? Has that gone beyond the 30-day period? And perhaps your own doctor, or if you have a PA in the practice, or the anesthesiologist from the facility can actually do that and clear them for surgery, providing they are relatively healthy without major cardiac or respiratory problems. And what about the second eyes? They now have been waiting for their second eye to be done, but they too will probably need to be seen very quickly to make sure that we still have a lifestyle effect affecting their activities of daily livings. And the patients, we have to remember that we have lost so much revenue during this down period, and we're really all about giving care, quality care, safe care to our patients. However, we also need revenue to get us back going again to a healthy bottom line. Therefore, the patients that had previously expressed interest in the premium lenses or the advanced technology surgeries really need to come back in first, because they should get back on the surgical schedule so that they can boost the revenue by the additional self-payment. And anything that can wait should be deferred, particularly your visual field tests. The visual field, if you download the Humphrey guide from Zeiss, you will see that you really should not be cleaning out the bowl. And it's possible that the masks that the patient is going to be wearing may actually affect the results of the field test. Chad, next slide, please. Okay, what about your space? You've been told from the other organizations and webinars that your waiting area needs to be socially distant. I'm not going to go into that. How you're handling reception, you probably have sneeze guards up between the front desk and the patient. But have you thought about the workflow? If the patient is going to be worked up in an exam lane, have the doctor travel from room to room. You don't need all of your rooms for workup right now with a lesser volume. So have the doctor travel. That way you're only risking contamination of one particular room. And have you thought about the break room and lunchtime? Because we know the techs are all the staff is going to be masked and gloved. However, they still have to maintain that social distancing when they sit down to lunch with one another. And what about your staff? They're coming back. They have concerns of their own. And so they need to be indoctrinated into what the new adjusted workflow is going to look like. They're going to be slower. We're not going to have that same amount, but yet they still need to process the patients in a very efficient manner. This is a great opportunity to cross-train some of your staff when you want your scribes to start to learn to do basic testing things. Perhaps your front desk can learn to do some of the diagnostics. That way you can pull them when necessary to do additional tasks during the course of the regular workday when we get back to it. And don't forget that this is an opportunity for them to continue to learn. There are plenty of online resources that if they're being paid to be home, I would suggest that you show them the way, the educational opportunities that you, the administrator or doctor, wants to promote. What about their PPE? They're going to need to know exactly what they need to wear, how often they have to wash their hands, how often they have to change their clothes. And you might also want to make some recommendations on how their uniform and frequency of uniform and cloth masks are going to be washed. Next slide, please, Tab. Okay, and the more you can prepare about for a proactive workflow, the better off you're going to be. There's plenty of technology out there to reduce the chair time that's with the patient. You might be able to engage in virtual check-ins. And while everybody is home, including your patients, have the patients called in advance, reconcile their medications, get their full comprehensive history. This is an opportunity to reintroduce the surgical counseling methods and as well as the Sergio Rhythm pre-planning for the right candidate, and have that patient be told that they really need to be bringing their own mask, as well as assure them that you have taken every precaution necessary to maintain a safe place of business. And everything that the patient, the doctor, the scribe, and the technician touch in the exam room and on the way to it must be disinfected between every patient. All of that is going to add to the time necessary to spend between patients. And last slide, please, Chad. Okay. So there are challenges that we are all going to come up against. Everyone is going to have some element of fear. That's your doctors, your staff, and certainly the patients. So by optimizing workflow adjustments, preparing everyone on your staff for what the plan is and checking in with them periodically to see what their concerns are will alleviate some of their own fears. There is still the risk of producing under the pressure of time. The patients may be lonely and want to talk, and the staff is now going to have more pressure because they know that although you're not at the same volume, they do have to keep to a safe schedule. And we need to balance the time of efficiency as well as the outcome. So John is going to talk next about how the opportunities are there to leverage technology, which in turn, long time may reduce your labor costs. Jonna?
Good afternoon, everyone. I'm Jonna Mulaney, Regional Vice President of Eye Care Services Partners, and long time, I should almost say resident of the Cats and Eye Group. You know, I've been thinking about, and Chad asked me yesterday, how has this pandemic impacted our practices? And the true answer is, I don't think any of us can really say exactly what the long-term impact is actually going to be. I think the smartest way to look at this is really, how do we control our recovery? You know, it's going to be up to each one of us, and looking at our individual practices, even down to the location level, to try to create a plan to recover from this as best as possible. Chad, you can go to the first slide. So, you know, a lot of things happened in March, and we were extremely reactive. Societies were changing, CDC guidelines were changing, and everything was happening overnight. You know, we didn't have a lot of time to plan how we were going to close. So in a lot of cases, we have to sit back and say, you know, what did we leave behind? You know, as we were making arrangements to close our locations, we didn't necessarily have the time to do it correctly or to prioritize it the way we want to do our ramp up. So you have to go back and look at what are the patients that we didn't see. You know, we put hundreds of patients on hold for 6 and 8 weeks at a time. So we have to have an actual strategy to identify how we bring these patients back. And while we kind of all know in our head what we need to do, you're going to be giving plans out to other people to do the work. So you actually have to have a well-documented plan that your management team can follow. And everyone's going to have something slightly different depending on what your specialties are. But, you know, prioritizing and doing that selective scheduling is going to be extremely, extremely important. When we look at staff and providers, you know, we laid off or furloughed or sent home a lot of people, you know, providers and staff included. So as you look at recalling them, what's your plan going to be? And Jane touched on this a little bit, but the when, the if, and the what is really, really critical. You know, you might be tempted to bring back a long-term senior tech or somebody who is extremely loyal to the practice, but that may not be your best solution. You might want to look for a utility player, someone who's extremely cross-trained who can jump in and help. And my personal favorite, look for someone who has a very positive personality. You're going to have a lot of people coming in, whether it's part of your team or your patients, that have a lot of nervousness, a lot of anxiety, and what we don't want is someone from our side portraying that anxiety. We want really positive people that are happy with all the efforts that we've taken, they're invested in the processes that we've put up, that they understand what our mission is, and that we are all focused on, you know, patient experience and making sure everyone knows the efforts we have taken to keep them all healthy and safe. When you look at providers, I think that's going to be dictated by patient necessity. You know, Jane mentioned making sure that you're looking at your medical follow-ups and the kind of patients that have been sitting there for 8 weeks that definitely need care at this point. They might not have been urgent at the end of March or the first week in April, but we might be bordering on that now. So start looking at your patient necessity and making a plan for the providers, and really look at those schedules and how you're going to stagger and how you're going to bring people in. And don't forget, we left behind a lot of vendors. Check your sample drops. How many of them are expired? How much of it do you have to get rid of? You know, what kind of contracts do you have pending? Turn your cleaning services back on, your laundry services, your sharps pickups. All the things that we had to put on hold for closed locations, we need to make sure that the day that we start, they know that we've started. And it's a good time to check on your service agreements. Make sure you turn your equipment on while you're not back yet. Make sure everything works. Make sure that you're on a list for service, because a lot of these things have been turned off for quite a long time. Jane touched a little bit on office configurations, and I know you've probably heard this from 1,000 people, but it's extremely important. It is amazing how far 6 feet really is when you're looking at waiting room chairs. So your waiting room volume is going to be very, very small. And even though we're bringing in a lot less patients, you're going to have a lot less room to work with when you start marking off 6 feet. So configure your waiting rooms and your reception areas appropriately. Start thinking about, we might let patients dilate in the rooms. So do we have patients wait in some dilating areas? And if you do, have a plan that you don't forget them. When you're looking at the extras that we're going to do, and we're all going to invest in some extras that we won't need forever, but we're going to need them for the short term. And you definitely need to understand that this is about patient perception as much as anything. So go the extra mile and do the extra little things that really, really give out that message that we are protecting the patient. Have sneeze guards where appropriate. Make sure that the signage throughout your office is appropriate. Don't leave hours on the door that you're not doing right now. Correct the hours if you have to. Have signs in the waiting room to talk about the steps that we're doing. If you're requiring masks, which I frankly think you should, make sure you have that on the outside of your building. Don't wait till someone gets in to tell them. And in my old clinical days, I couldn't stand the breath shields. I used to take them off all the time. Well, now you got to put them back on, and you're going to have to deal with it for a while because you really need those. Again, it's another patient perception. And workflow changes, as Jane touched on, you're going to have more time, but you're going to have less staff. You're going to have less patients. And while you may think you have more time to spend with those patients, and this is going to be a real true advantage to take that extra few minutes to educate the patient, keep in mind that patient may be a little bit anxious about that extra time. So use the time wisely. Don't go on for 20 minutes because you have 20 minutes. If you have 20 minutes, make 10 minutes of it really count. And if you can get that patient out of the room a little quicker, you should try to do that. Next slide. I don't know if I'm on a delay. Okay. So added protocols. I started using Surgery Rhythm a year ago, and I can honestly tell you that it has made us more efficient. So I'm truly excited to see how we add a little bit more of these technologies, what it's going to do for our practice. Pre-mobile check-in and virtual waiting rooms are definitely something that we're investing time and effort into. But some of the digital intake, and again, this is really a lesson we learned from Surgery Rhythm. Get as much information from that patient, as Jane stated, ahead of time. But that goes along with your cataract evaluations too. You might be getting their past medical history and some of their medication, but start talking to them, especially using the reports. Start talking to them about what are they looking for? Do they want to get rid of their glasses? Are they interested in financing? Make sure you've started that conversation. Again, get as much information ahead of time and really take an opportunity for pre-patient education, so that all of our efforts are towards minimizing the time in the office and maximizing the time that we have. So we really rely on these patient insight reports that Surgery Rhythm presents to us, and I think this is a time where look at those ahead of time. If you're using the system, don't wait until the morning of, which has been our normal strategy. Start looking at a few days ahead of time and make that really valuable phone call and try to go over these reports ahead of time, and again, reducing that face-to-face time. I think we have an example of an insight report to show you. I love this one because it's green. That's a great patient who's ready to move forward with some premium options. But again, these are the kind of things you want to look at. Your rhythm is going to change a little bit, and instead of having a whole bunch of them stacked up for the morning of, maybe start looking at those 3 days before. And next one. So now we've thought about what we left. We thought about what we need to do to prepare, but let's look at the next 6 weeks. So, I think we all have a tendency, we're planning the first 2 weeks and then we'll see what happens, but let's remember it should be a 6 to 8 week plan. And we really need to do this right. It's almost like our second first impression with our patients. So take it slow and plan it accordingly. And remember, really respect the fact that there's a high fear factor, and that even if the next 2 weeks patients start to come out again, if we start to see changes in the news, the fear is going to come back up. So we have to always keep that in mind. Don't be tempted to burst your schedules after a few weeks. Keep them limited for a while. Really plan this out. Know that you have a good, strong 6-week plan. You're going to need it for your staff. You're going to need it for your doctors, but the structure is going to be necessary to do this correctly. And stagger your comebacks. You know, as much as we all want to get back to work and our doctors want to get back to work, everybody can't come back at once. We will not be able to manage the social distancing and all the extra precautions that we're putting in place if we bring back people all at one time. So stagger it. And it will be longer days and longer weeks, but maybe you start somebody at 7 and you start somebody else at 9 and you start somebody else at 11. And maybe doctors that aren't used to working Saturdays add some Saturday hours. We have a lot of pent-up demand. We have to do our best to try to fit them in. You know, that 15% loss that Chad talked about happened in a short period of time, and we have a certain amount of time to make it up. But I think Jane touched on a lot of the things I'm going to suggest, but the 90-day cataract evals are probably somebody that you should be looking at early on. You may have to do re-evals, and you may have to talk to patients about redoing their pre-ops so that we can keep our schedules for May and June. LASIK evals, you know, you might be in a market where if they're lifting restrictions on Friday or next week, that you've got some patients that you saw in January or February who might have been interested in LASIK. So take an opportunity to call those patients and find out where they are. There may be a lot of financing deals available. You don't know what the interest rates are going to be, but this might be an opportunity for them prior to their major summer events that they can start looking into LASIK procedures. And, you know, obviously the glaucoma patients and the cornea follow-ups, those are the kind of patients you should be looking at. I did hear somebody mention in another meeting that diabetic patients and diabetic eye exams are another good one, but I actually don't agree with that. Diabetic patients are in that risk factor, so I don't think that they're ones we should push too early. And then adjusting to your new workflow. You know, when is less more? I think at the beginning, as I said, you're going to work with less technicians, so make sure that you're utilizing the technicians in the best way possible. And I really think you have to talk to your doctors and your managers and make sure that everyone understands there's a new mindset. We will be moving at a slower pace, and it will be necessary. You know, we will be trying to present a positive attitude and certainly give patients the confidence that we are doing everything to protect them and our staff. And I think that synopsis change is going to be important. You know, don't have a doctor who's willing to let patients stack up in rooms and then go see them all at once, because that then crowds your checkout and crowds your waiting room. So we are going to have to change our normal patterns of behavior. And then my last part is about utilizing the new strategies and technologies. And I think we have one more slide. So I am really a big fan of the surgery rhythm symptom checker. So when you're looking at new strategies and new technologies, consider some of these new things that have been developed in the last 6 weeks to help us out. You know, we want to reach out to patients ahead of time and make sure that they don't have any of the common symptoms, but Surgery Rhythm has actually developed a tool for us that makes this considerably easier than us trying to call every single patient. So when you have an opportunity to take advantage of these new pieces, really look into them, really research them, and get them into place if you can. They're going to be very, very valuable tools in our toolbox. And I know I talk fast. I appreciate your time. Thank you.
Jonna, thank you. While Crystal's bringing up the camera, let me just mention to everyone as well that if you have any questions for any of our presenters today, I invite you to put those on the questions part of the dashboard, and I'll moderate those and present those to the group at the end here. All right, Crystal.
Yeah, awesome. Thank you, Chad. If you could advance to the next slide there for me. I am Crystal Momojar. I work for the Cleveland Eye Clinic. I am our clinical operations manager. And I'm going to talk a little bit about telehealth today. So first, I just want to start off by saying that I think that we all need to be very sensitive to the fact that patients' expectations are going to be very different now. They will expect to see new safety protocols in place. They want to see staff wearing masks and gloves, maintaining social distancing, less wait time for them in the office, constant cleaning of equipment and services, Information collection prior to the office visit, as well as education prior to the office visit, like Jane and Jana have previously mentioned. And then also implementation of new technologies like telehealth. And so all of these factor into whether that patient feels safe throughout their exam. And if they do, it'll make for a very positive experience for them. So at the Cleveland Eye Clinic, we took a look at our list of typical telehealth appropriate visits. I'm sure everyone has that list: chalazions, conjunctivitis, etc. And then we took a step outside of that box and thought about our medical evaluations and asked ourselves, why can't we perform a cataract evaluation or a lid evaluation via telehealth? And so by taking those quote unquote appropriate appointment limitations off, it allowed us to expand our services to be available for our patients in a way that we never have before. So our process change and push for telehealth really began at the end of March and took off at the beginning of April. It required the creation of many new protocols, as well as training and education for our teams and our doctors. So prior to this approach, our doctors were reviewing their schedule and determining which patients would benefit from a telehealth exam. And by doing this, we realized that we may have been postponing care to a patient that truly needed it. And then also thinking postponing so many exams, we're creating a large volume of patients needing to be seen upon reopening. And knowing that our clinic and our surgery schedules will be limited due to social distancing and all of the new safety protocols put into place, we knew that our telehealth process was going to help us create our patients, help us keep our patients and staff as safe as possible without limiting accessibility or postponing any care. So we adjusted our scripting when making calls to notify patients, telling them that the doctor wants them to keep their appointment. It's important for the health of their vision. And we're able to perform a virtual visit, which is covered by their insurance company in the comfort of their own home. So for convenience of the patient, we built telehealth schedules for our doctors so patients could keep their pre-scheduled appointment where possible. And we assisted the patients in downloading the appropriate platform needed to complete the exam and emailed them an aid that walked them through how this virtual exam works. So we wanted to educate patients, these cataract patients, and prepare them for their virtual cataract evaluation just as we would an in-office visit. So we utilized surgery over them in a very similar way to what we have done in the past. So prior to their telehealth exam, the patient would receive a text message with the link to the questionnaire. And then the answers of this questionnaire are focused down into a snapshot called the Insight Report that is shared with the doctor and the surgical team so that they can have a very focused conversation with the patient during this telehealth visit. You've already seen one snapshot of that Insight Report earlier. Chad, if you could go on to the next slide here. This helps the doctor prepare for the day. And like Jana said, it doesn't have to be the day of that evaluation. It can absolutely be, a few days in advance to help prepare so that, maybe an educator can reach out to this patient to further assist with any follow-up questions that they may have. But just this snapshot here of the schedule gives our doctors a lot of information without even needing to open up that Insight Report. They can see that they've got two, little white circles there. Patients are fine with wearing glasses, and then they know that they're going to focus a lot more attention on those orange and green candidates. So you may be wondering, how can a doctor perform a cataract evaluation without examining the patient through a slit lamp? So our doctors obtain a thorough medical history from the patient and ask the patient very specific questions regarding their condition, like, what changes have you noticed with your vision? How have these changes affected your activities of daily living? When did these symptoms start? And plus, many of these patients have been previously diagnosed with a cataract in the past and are now looking forward to move forward with surgery. So using the information from the Insight Report, as well as the telehealth conversation, the doctor and patient create a tentative surgical plan. Then we have our surgical counselor reach out to the patient to reserve OR time, counsel the patient over the phone, and then we set the patient up for a same-day surgery appointment. So then the day of surgery, the patient starts out on our clinic side, where a technician performs all necessary testing. the surgeon will come over and meet the patient to finish that exam and confirm that surgical plan. And then after that, the patient is walked over to our surgery center to proceed with surgery. So as you can imagine, this visit with a surgeon is a very quick confirmation visit. So it allows our surgeon to minimize that chair time and maximize their OR time. Chad, if you could move on to the last slide here. So lessons learned. Don't forget to educate patients. So we jumped into telehealth very quickly, but we were not as quick as we could have been to get the process for patient education up and running with telehealth. We have access to this great technology at our fingertips, which we were able to implement back in very quickly. But ultimately it's our responsibility to ensure patients have all of the information needed to make an informed decision for surgery that suits their lifestyle and visual goals. And Surgery Rhythm allows us to do that in a very safe way for patients. So from the patient's perspective, they're maximizing their time by making less trips into the office. They're in the comfort and safety of their own home. The patients are really enjoying the telehealth visits as they're getting more face time with our doctors than before. Our doctors are very passionate about providing care to patients, and they are thrilled to be able to do so throughout this pandemic. And the patients are very thankful that they have access to a doctor who cares not only about the health of their vision, but their overall health as well. So as we look to reopen, we anticipate utilizing a combination of telehealth and traditional office visits. And we feel that this will make social distancing in our office easier, and it'll free up additional appointment times for those more routine vision exam patients who need to come into the office. So overall, a safe and positive experience for all.
Thank you, Crystal. This is Diane Weiner, co-founder of Surgery Rhythm, and we so appreciate all of our speakers today. I'm just, for the purpose of bandwidth, I'm going to turn my video back off, but I'll come back in a minute and we can get started. So Surgery Rhythm is an ophthalmology-focused technology solution. We're based in Nashville with a cloud-based software as a service model. We have a monthly licensing fee per participating doctor. We were built to help practices prepare CAD-eval patients to educate at home, relieve pressure and staff time in clinic. Our value proposition is to increase scheduled to surgery rates and self-pay adoption. I want to take this opportunity to thank Chad and our partnership with Advice Media. We are all about patient communication and education, and having the site selector videos to supplement what we do has been extremely helpful. Next, please. Thank you. So like Advice Media, we consider ourselves in that marketing realm. And as an internal marketing program for cataract services, we're helping practices improve productivity, surgery rates, and premium sales. Next, please. Patients do their work at home to arrive prepared and ready to have meaningful conversations with doctors. And as you heard from Crystal, this can also apply to telemed sessions. So step one is for patients to do their online work at home with Surgery Rhythm. Step two, doctors and counselors get what you already heard about, the Surgery Rhythm report per patient. It's used to understand the patient motivation and site goals and focus the evaluation discussion on the why. We all know the importance of understanding the why in the patient purchasing decision. And three, for the practice, in addition to the data analytics and the key performance indicator reports, we're giving your call center managers with COVID-19 alerts regarding patients who need attention before they arrive. Next, please. So how do patients get to us? Patients are onboarded to our program in one of two ways. Either they have a scheduled CAD-eval appointment, and so we talk about, like for next gen, we talk about event types, right? How they're coded. This information is uploaded to us. A second access point would be an external OD, and they're being referred to your practice, and we call that access our self-enrollment module. The patient-facing experience works as follows. We call every patient, and they're either sent a link or we review by program the non-technology users. We'll show you in a minute how that works out between technology users and non-tech users. The program received online is branded by your practice with your name and logo. Patients complete at home, they come prepared, they know the options your practice offers, they've thought about their desired visual outcome and affordability factors. So you see on the screen the three components of the program: the questionnaire, the package comparison chart, and educational videos. Our live contact center calls every patient to enroll them in the program, and we think that warm touch is super important, even more important now. We are calling on behalf of your practice. We don't use the word surgery rhythm. We are representing you. Next, please. Just a quick look at how our patient self-enrollment option is presented to the patient by the external OD. Next, please. So it's about transferring activities as much as possible to the home setting. And our main service expertise through our team is to work with patients at home before they come to your practice, whether online or by telephone if they don't use technology. Let me take this chance to say to our team who's on the webinar with us, a big thank you for your support. We would not be here without every member of our team, and we so appreciate you. Next, please. Safety and productivity in the workplace. So this is a way that we've adjusted with COVID-19. We have extended our program. Jonna mentioned this, and with help from our customers with feedback and with input. We are a customer-driven company. We did a couple of extensions. On the left side, you see the safety extensions. So this is the, it was incorporated as part of the existing patient experience 1 week before the appointment with underlying conditions and exposures per CDC guidelines. The day before, also on the left, the patient gets a text message symptom checker with alerts to the practice. And referring back to some of Jane's comments is don't waste the appointment slots. And we really want to avoid patients who may be canceling the day before, or maybe there are no-shows, or maybe they get to your desk and you have to send them home. So we're doing this in advance to save the safety and also maybe give you the chance to fill the slot. So look on the right and you see productivity. So here's what we call smart scheduling tools to support your productivity. You'll know in advance using the patient insight report if the patient says they're diagnosed. And this makes a big difference. If a patient tells us in advance, hey, I don't even have cataracts, you may have a wrong event code put on by mistake, taking up a long slot, and you will have an alert from us so you can check with the patient and maybe change the event type. You'll have a predictor on ready to schedule. And so rather than a patient who may be coming to kick the tires, you can try to fill your schedule with patients who have confirmed that if the doctor says they're good, they want to proceed. And then third is ready to pay additional. With these safety and productivity attributes, practices can give higher priority to closing the backlog in an intentional way and to recover revenue. So what you see in front of you now are the safety alerts with the red alert signals. And this is how, using the Today tab, you can know who to give attention to. And on the right, we represent this information in what we call a section or a card on the patient insight report. Next. Another quick look at our patient insight report. Jonna showed you a green patient. Green means I'm on the premium lane. Start with premium. Here's all my information that I've provided to you in advance. And here you see another example of an orange. So we have patients divided into 3 cohorts. Green is premium and orange is a maybe. So the maybes are still good candidates to consider your packages that will give them their sharpest, best vision. but you are going to spend a little more time with somebody who's a maybe. They want to be glasses free. You can see that under priorities on the top left, but they're worried about affordability. So we know that's the top perceived barrier to taking one of your enhanced packages, is worried about affordability. So the 32% is our predictive algorithm. It helps you understand how to frame and focus to specifically address the interest and the worries of the patient. And that's what it's all about, is getting the patient their best outcome for patient satisfaction. You can see on the bottom, I'm sorry, go back one second. The bottom right is that alert on the self-reported conditions. Next, please. So here's a quick look at the smart scheduling. And we talked about the 3 indicators for you to use as you're catching up now, coming back from the cataract evaluation pause, and making every appointment count. Next, please. We are a data-driven company. I don't know, we talk a lot with our customers about reports, KPIs. We have monthly reports. This is just a quick snapshot of time for practices to show that we address the scheduled to surgery rate for all practices versus referral, and then self-pay conversion. And this is the type of data that you will get from SurgiRhythm. What we find on the self-pay component is that if you have a practice of a number of surgeons, some are going to be higher and some are going to be lower. But by helping those who are maybe just starting out with their tactics and their tool sets, we're able to help achieve more patients to take your advanced options. So this is about it for our component. Just to let you know, we are a growing company. We are helping practices actively get back to business, close the backlog, and thrive. And we will open for questions now. We so appreciate everybody coming and being with us today. Back to you, Chad.
Perfect. Diane, Crystal, John, and Jane, I'll give all of you a chance to unmute yourselves, turn your cameras back on. That was great. You know, and I appreciate each of you taking time to be here with us today. We've had a very engaged audience. I'm able to watch and see all this, and being data driven is so important. A couple questions that, and I'll kind of throw this out to the group a little bit, is we're talking about communication. What things have you found work well for communicating both internally with your employees, as well as how are you communicating outside and letting people know about the new safety standards that are going on and what you're doing, so you can kind of ease their fears?
So I think that Crystal had such a good presentation on the way that they've been communicating with patients. She might be the best one to answer. But I can tell you that one of the things that we're really, really focused on, not only is the communication with our staff, but making sure that when a patient walks in the door, they see at the waiting room, at the entrance, everything that we're trying to do. We're keeping our websites, our social media pages up to date. And we have a really talented marketing team that as soon as we're ready to pull the trigger, they're ready to pull the trigger, and they've been working alongside us as we've been planning our go live.
Good, Crystal.
Yeah, absolutely, Jana. Yeah, so I think that Jana, we're doing a lot of the same things as far as, you know, letting patients know what we're doing, you know, whether that's on our social media or on our website. We're sending out blasts to all patients, you know, a message from our doctor. And then we've been performing a lot of virtual meetings with our teams, a lot of Zoom meetings, a lot of, you know, text threads to, you know, keep everyone in the loop with what's going on, what changes are happening, you know, when we need them to come back in to do some training on how we're going to implement these new safety protocols. So definitely a lot of virtual meetings.
So if I could ask both of you a question, Jana and Crystal, how are you communicating to your doctors?
A lot of regular communication. Yeah. Go ahead, Crystal.
Go ahead, Jana. So we have a weekly meeting with all of our doctors via Zoom where, we jump on and, whether that's a training that we're doing, just to catch everybody up, some future plans, as, our governor, DeWine announces new information, we're talking through all of that with our docs, talking through all of the safety protocols. So again, virtually.
Yeah, we're doing a lot of virtual and email communication. I find that I can document and bullet point, all the steps that we're taking in an email and know that the message is communicated. So I've been trying to use that. I have a large group, so sometimes the email communication is the most effective.
Yeah, that's great. One of the update methodologies, I just want to throw this in there as a marketer as well, is the importance of keeping your Google My Business up to date. I think, Jonna, you mentioned updating the hours on the office. If you've got it posted somewhere, keeping that up to date. Google My Business and your website is another part of that needs to be updated so that you don't frustrate patients through this process. Let me throw this question out to our group as well. I was on another webinar yesterday, kind of listening in, or actually 2 days ago, excuse me, and they mentioned that one of the stress points that exist is that your patients, the ones that you want to treat, are in a tough spot as well. They're now going back to work full time. Maybe they've been on a furlough. They may not be able to get time off during work hours. It was kind of mentioned that might be Saturday hours. What are the practices going to do about later hours? Might be evening hours, different things. What adjustments are you recommending to the practices that you serve, or within like the Cleveland Clinic or Jonna, within your practices, to be able to serve your patient population and meet their needs?
One of my most recent communications to my group of doctors was start looking at your schedules in the month of June and start thinking about in June and July, what extra times do you want to offer? Do we want to go later? Do we want to start earlier? Do we want to add Saturdays? As we're looking at bringing staff back, we have to keep those things in mind, because we might be looking at employees used to working Monday through Friday from 8 to 4, and we might be talking to them about a 7 a.m. or a 7 p.m. or a Saturday. Our Saturdays that were 9 to 2 could become 8 to 5. I think we have a pent-up demand, and we have doctors that are ready to work and patients that are ready to be seen, but an economy that's waiting to start. So if you have to have your eye exam or go back to work, you're probably going to choose go back to work at first. So we have to be flexible enough to be there when our patients are ready.
Crystal, and then Jane.
I also think that with limiting our schedules, and especially in some of our smaller offices where we may have had 2 doctors running at the same time, like Jonna said, splitting them up, having one there earlier, having one there later, and that right there is opening up your hours of availability to patients. And then also, again, I feel like I've said it a lot throughout this webinar, but telehealth, so you could easily perform a quick telehealth visit, on your lunch break, or, it's just definitely very convenient for the patient. So something else to keep in mind.
I also think that you can approach this from another angle by explaining to the staff that you are going to be extending your hours, and with no guarantee, what are the hours that they would prefer to work? Because we have to think about someone now who might have a significant other, a spouse, or a grandparent at home who can help out with the children, so they may actually be able to work and prefer to work that evening or Saturday instead of the Monday to Friday regular shift.
All great ideas. As we wrap up today, I want to again thank our presenters today. Diane, thank you again for putting this together. Jonna, Jane, Crystal, thank you for taking time out of your schedules to be here and to share this valuable information today. The information you shared is so important, and as our practices are either opening up this week or in the near future, it's critical to really think about all of what has been shared today. This webinar has been recorded, and it will be made available to everyone here. And so you'll be able to, you're going to receive automatically a copy of it. So, to rewatch it, to share it with others at your practices, and please take it, distribute it liberally. It's all there. Additionally, on the marketing side, if you're looking for some additional information on how to enhance your marketing, at advicemedia.com, I've put together a very substantial COVID comeback document, as well as a lot of videos and blogs and articles on some tactics you can be putting together right now that are going to assist you as well. And so I invite you to go there and download those. But if you'd like more information on how to really streamline your patient flow in your practice, I invite you to reach out to Diane. Her email is listed here on the screen, and get a personal demo from her. She's already shown you quite a bit, but you heard from our other experts on the panel today about how this has really maximized their practices and helped them with their flow, and helped actually maximize their dollars. So I could not give a stronger endorsement to what Diane and Sergio Rhythm are doing. Thank all of you again for attending today, and for our expert panel. Thank you so much for what you've shared. Wish everyone the best. Please stay healthy and stay strong, and good luck as you reopen your practices. Thank you so much.
Thank you, Chad.
Thank you.
Thank you to all of our speakers, and y'all have a wonderful day.